customer. No. Clicker, thank you. Real pleasure to be here today. Thank you, Reed. Wonderful presentation. In fact, I think you'll find that the last couple slides that I have play right into what he was saying about his conclusions around telehealth. So I'm feeling a lot smarter all of a sudden. Because like Reed, I'm also not a telehealth expert. I come from the payer space. I've been in the payer space for about 20 years. But I'm a public health professional. So all my work has been population health, technology, product development, strategic consulting, that kind of thing. And find myself the past couple of years working in the experience space of providers. So today's talk is actually about what Humana has learned over the past couple of years about simplifying the care experience. Humana is a payer, but it's also a provider. It has 60 years of history. Primarily today, we serve older adults through Medicare Advantage plans. We're also one of the largest mail-order pharmacies. We're also the largest home health care company with our acquisition of Kindred. And we do a number of other things like support military families and active duty and their families, retirees. So we do a lot. We are based in Louisville, Kentucky, and I've been there for 20 years about. The point I want to make today is that Humana, for about the past 7 years, has been on this consumer experience journey. We have built a consumer experience center of excellence that has been working throughout the various lines of business to understand through human-centered design and research and through culture change experts and process improvement experts how to improve the experience that our members have with interacting with us and with the healthcare system as a whole. The proof's in the pudding. We've, over the past few years, have been number 1 and number 2 across most of the satisfaction survey, like J.D. Powers or Timkins or Forrester. So we feel pretty proud of our achievements to date. However, there are so many more frontiers for us to work into, and that's what I've been doing the past couple of years, is looking at this new landscape of the provider and what can we do to influence the experience of our members when they interact with primarily primary care physicians as a start. That work began outside the physician office, as I think all good experience work should, is just before you start focusing in on what are the issues that you're trying to solve within a particular end user, in this case the clinician. What's going on outside? What's the context? So certainly we've been listening to patients for a while, and what we know from them is they've learned a lot from other industries around what to expect when it comes to service. And that's putting great demands on the healthcare system, as many of you know, and you're all representing brands or products or services that are taking advantage of these new technologies and new expectations and delivering those as best you can to satisfy those needs. The industry itself, as you know, is very fragmented, and it lacks transparency. There are some evolutions when it comes to acquisitions. We're seeing retail pharmacies connect with payers, and payers become retail providers, and pharmacies become providers. But that really hasn't addressed the fragmentation issues. And at the end of the day, it's just not a lot of transparency around what's going on if you're a patient or you're a provider across the whole system. Providers themselves, as you know, are overwhelmed, documentation requirements with authorization requirements from payers, reimbursement issues. They're buried. And they're also trying to run a practice and learn about value-based care and all these other things that are going on that are coming in from, among others, the government, who is certainly the biggest gorilla in the room when it comes to organizing payments and being a provider themselves or being a quality overseer. Or, it's just a lot going on that these physicians are facing on the outside. So with that as a context, we started walking into the clinics, and we spent some time over a good 6 months talking to 200 different physicians, also patients, but also office staff, other nurses, back office staff, to understand what really is going on in their practices that needs to be addressed. And the 4 major themes that came out of that were that they're spending way too much time to prove that care was delivered rather than actually providing the care. One of the things that we know about is because we're part of that problem, right? As a payer, we're requiring them to provide documentation on behalf of CMS or even our own policies to ensure that we are making the required payments on behalf of the benefits of the members that we support. But there's also the issues of 36 hours of their office time weekly, making faxes and phone calls just to check in to make sure that they're doing the right thing when it comes to getting reimbursed. The other issue is they want to provide comprehensive holistic care, but they don't have a complete picture of that care. So what are they supposed to do there? They find it hard to manage across measures of cost, efficiency. So the population health view is very important for them. They need to have the access to information to help run that practice, to understand their value-based care contracts, but they don't have the time or necessarily the tools to do that. And finally, they find it frustrating to know what care patients are receiving outside of their four walls. They have the EMRs, but those EMRs don't necessarily connect to any other EMRs, so they're oftentimes very isolated in their care decisions. So in those talks, we came up with some hypotheses. We thought, as a payer, what can we do? We certainly have data and insights that can create meaningful value for physicians, we think. Let's confirm that with them. We know that providers value relevant data and insights when surfaced within their own workflow. So how can we do that? And then we knew as a company, it would be feasible and viable for us to start thinking about these experiences in these terms of providing data and insights into the workflow, because we're trying to work in a more integrated fashion across the business. So we set out to reduce the friction and simplify the care experience by starting to think about where do we address these pain points for physicians. So quickly going to get through this. Together we sat down with physicians and said, okay, let's imagine the vision of the future of us working together. What would it mean to simplify the care experience? And what we came up with was, they said, can you stop working with us or asking us to do so much of this administrative work? There's got to be ways we can address that. We said, absolutely. They said, you have a lot of data on our patients that we don't have. Could you possibly share that? We said, absolutely. They said, we have a care team that's doing work on some of these patients who need chronic care management, but we know that you, as a payer, and them as members, are also interacting with them and trying to provide care management. Can you give us some of that information as well? Let us know so we can collaborate better? Absolutely. Finally, on the bottom, the care ecosystem is expanded and connected across clinical, social, behavioral areas. How can you help us screen and refer your patients or your members to services that they have benefits for that can support their social economic needs, for example? Well, we can do that for you too. And finally, for you, we'd love to start delivering care in a variety of different ways through multiple channels and models that will optimize the care. So not just here in the office, how can you help support and give some telehealth benefits? So obviously today we are working with Doctor on Demand for all of our commercial business, and we work with MD Live for all of our Medicare Advantage business. So we did one more drill down. I'm running out of time. That was to find out, okay, where do we start? They said, well, start with your health plan. Tell us about the beneficiary coverage and benefits. So that we can know when we make a decision for care, right up front if it's going to be something that the patient can afford. Number two, providing real-time transparency for authorization requests. So can you streamline the authorizations? And we said there's a number of ways we're doing that. In fact, we have an authorization collaborative internally that has 16 different projects to simplify the authorization experience. I can tell you more about that offline. Three, the entire patient health history. That's the third most important and desired data that they want. Please provide us some more of that information. So today we have a longitudinal view of the patient that we can serve up to EMRs. We have two of our major EMRs right now that we're working with to serve up that data into their EMR so they can provide that holistic view. And finally, you have information about our patients' health that sometimes we don't have. Say, for example, medication adherence. Can we have some of that information? So we're prioritizing all of these initiatives and putting them into the workflow. Which leads me to, I think, the next frontier. When I was asked to come and talk to you about these initial findings and what we're doing, I started looking into what we know about telehealth and the place of care and how different care can be delivered through different models. And we started thinking about, we certainly need to encourage anyone in the telehealth industry to think about the same flow that we're thinking of when it comes to putting data and insights into the flow. And I think one of the other key areas we need to understand more, and I think as a payer we may have some of that information, is to help guide and motivate both physicians and patients to understand what is the best mode of interacting with the provider. Certainly it's in their best interest to know, is it a convenience factor, all the other factors that Reed was talking about, what would make them want to adopt? So we want to be there to support those decisions if necessary and make sure that we have the services available to them so that they can have it. And run out of time, but finally, I was thinking, a question to you. As we as a payer think about data and insights we want to deliver into physicians' workflow, now the telehealth industry is really kicking off. What are opportunities for you to use health payer data? What kind of data about cost, benefits, PCPs that they're connected to, medication information? What would support you and the experience that the telehealth service would provide in making that simplified care experience happen? So that's where I'll end. Thank you.
Hello. I commend work with different payers and PBMs, and really commend you on. There's truly this idea of we want to make things easier for providers, from smart prior authorizations to real-time benefit checks and whatnot. The thing I find as a physician, though, is no matter how well you do your job, it makes up a fraction of the patients that we see. Right. So I don't see, this is my Humana patient, my Cigna, my Aetna, this is Joe, John, Jane, and whoever in between. Is there anything in here that's of organizations coming together to try and simplify this, so as a provider I can simply, this is my patient, this is what I'll do for them, and this is how it works?
Thank you for asking that question. That's one of our key barriers. So that works at two levels. So one level is there is what the ONC is doing around APIs and everything. I'm serving on the Fast on Fire Tiger team for pilots implementation, and so we're working across all payers and other stakeholders to work on the top use cases. Authorization is one of the top ones, and real-time benefits, so that we're all adopting the same APIs, same approaches, so that we can get the data into the same EMRs, so that is not an area where we're competing. We don't need to compete on any of this stuff, in my opinion. Other level, though, is we've, again, around the authorization process, we just spun out a company that's going to be payer agnostic. That's why we spun it out, to create clinical guideline pathways that will, when adopted by physicians, give them a pass for whatever, the next 6 months, whatever it is, for that knee or joint replacement. So everything is pre-authorized. And so they're not coming back to us 4 or 5 times to get every single event authorized. So it's all done up front. And then you think about the opportunities there. The data exhausts from us knowing for the next 6 months what's happening with that patient, and the physician's no longer spending 36 hours trying to get the authorizations. We can think about not knowing what this patient is going to be going through. What can we do to support that patient in that journey? So that's my 2 examples for that.
So I assume you must have an internal business models, because this is not a cheap effort.
Right.
Who is going to pay for all the things you're providing? What's your business models? Are you absorbing the cost?
We absorb the cost, yes. It's an investment, yeah.
You're going to absorb the cost?
Yes.
This is regarding using AI and streamlining the processes. In case of prior authorization, I believe most of this works on your end based on some predefined algorithms. So are you applying AI solutions where someone who's waiting to go to nursing home, we can just plug in the data and then we get the answer right away? Is there anything like that coming in the future?
Yes, that's exactly what we've been talking about. How can we, in fact, there are certain authorizations that shouldn't even need to show up. The physician doesn't even need to think about the authorization. So our hope down the road is when they're working in the EMR and they have an opportunity to think about a certain path for referral, an alert shows up and says, no authorization required, and just, they just move forward. Does that answer your question?
I'm using an example of mainly just that when somebody is requiring nursing home from the hospital discharge, and so many times you have to wait for 1 or 2 days before the authorization comes through. Mm-hmm. And that also is pretty simple. I mean, there's only few data points which you require, and most of the time these things are seen by some human on the other end. Right. That's what the delay comes in. So is that going to be streamlined, things like that?
That's a good example of what would be streamlined. Absolutely, yeah.
Great. Any other questions? All right. Thank you so
Thank you.
much, Erik.